Now, today, countries all over the world are observing World Diabetes Day. Diabetes is the 7th leading cause of death worldwide. According to the World Health Organization, over 422 million people are currently living with diabetes, compared to only 30 million in 1985. And by 2040, it's predicted that 642 million will have diabetes. In Uganda, the current prevalence of diabetes is 1.4%. That is to say, about 500,000 people have diabetes and impaired fasting glucose, which is a risk factor for type 2 diabetes, affects 2.1% of Ugandans. To help us put this and a lot more in perspective, I'm now joined by Dr. Suzan Nakirekka Tumwesigye. She's a physician at Mengo Hospital and the secretary for the Uganda Diabetes Association. Good afternoon and welcome to NTV.
Thank you so much for having me here today. Today we celebrate World Diabetes Day. We join the rest of the world to celebrate this day. And Uganda Diabetes Association, together with the Ministry of Health and the Uganda Protestant Medical Bureau, are having the celebrations in Nakaseke district. That's where the activities are.
So Dr. Lumu is already there?
Dr. Lumu is already there.
So let me hope you already sent over the assistant. So let's get into it. What causes diabetes?
Diabetes, we have two main types of diabetes, type 1 and type 2. And 90% of people with diabetes have type 2, that is the adults. And actually, the figures currently, the most recent figures are at 463 million, that is 9.3% worldwide. So the causes of diabetes, who is at risk? The people at risk of getting diabetes are those people who are physically inactive, people who eat unhealthy diets, people who live a sedentary lifestyle are at risk of diabetes. If you have a family member with diabetes, your father, your mother, your first relatives with diabetes, then you're at risk.
So how often should I test my blood sugar, and what should I do if it's too high or too low?
So we encourage adults to have an annual check for diabetes, at least have a check once in a year, because 50% of people with diabetes are not diagnosed. So there's many people who are not diagnosed who have diabetes. And for prevention of diabetes is possible if we can target the people at risk, those people I've mentioned, and have physical activity, healthy diets, and also exercising.
So how regularly. Do you know you have diabetes in the first place?
In the first place,
what are those symptoms?
Symptoms, 50% may not have symptoms, but symptoms are usually excessive urination, excessive thirst. People lose weight, they have recurrent infections, and they have a high appetite. They eat, but they lose the weight. So, and also other symptoms, but the commonest are weight, excessive intake of fluid, excessive urination, and excessive intake of food.
Does having diabetes mean that I'm at a higher risk for other medical complications?
If you have diabetes, you are at a very high risk of complications, including kidney damage, eye damage. People are blind. Many people who are at the kidney clinic have diabetes. In Mulago, those who are undergoing dialysis, they have diabetes. You're at risk of damage to your nerves, and then you can eventually get amputations of your limb.
So are there any new medications that I could use to manage diabetes? Medications,
currently we have several medications, including the oral, the tablets, and insulin. And currently we have a new insulin regimen, which are very helpful in management of diabetes, and also tablets that can be used.
So between insulin and pills, which one is better?
Both are useful in our treatment. It depends on the level of control of the patient. So we introduce the different treatments according to the control of the patient. Yes.
Dr. Suzan Tumwesigye, thank you very much for having made the time to speak to us.
Thank you for having me.
Well, Dr. Suzan Tumwesigye is our physician at Mengo Hospital, and she's also a member right there on the Uganda Diabetes Association. She's actually the secretary. You heard from her, so you know what to do with regards to combating and managing diabetes. Right about now, let's take a very short breather. We'll be right back with a lot more.